Hi guys, this is chapter 9, joints, and just so you know, this is take 1801, so we'll see how this goes. So for joints, chapter 9, we're going to be able to identify the characteristics used to classify joints and be able to name examples of each type of joint. Okay. And so to start off with, joints are specifically articulation points. These are two places or two bones that are coming together. And we can classify them by structure or by function. So for function, this means how much do they move? And then structure, what are they made of? Are they fibrous? Are they cartilaginous? Are they synovial? Let's see. So when we talk about function, again, how much are they moving? Synarthrosis is a type of joint that is immobile, meaning that they are not going to be able to move. And these are strong bonds. This is important at locations where our bones are going to provide protection for internal organs, like for instance, those of our skull. Remember, at our axial skeleton, we're going to find a lot of these immobile joints, okay, because they're for protection. Suture lines are like that. The manubriosternal joint, this is where the manubrium, the top part of our manubrium, joins the body of the sternum, again, for protection of the heart. We also have, as far as function goes, amphiarthrosis. And amphiarthrosis means that there is limited mobility. We're not moving these a whole lot. So our intervertebral discs, we have to be able to move our spine just a little bit, and our pubic symphysis has to be able to have some give as we're walking. But we don't want them to move a lot, not like our diarthrosis joints. Diarthrosis joints are freely movable. And we're always going to find this. We're going to talk about synovial joints here in a second. But we find those in our appendicular skeleton. Remember, at our appendages, we need to be able to move them a lot. These can be divided into three categories. Uniaxial. Uniaxial means that they're able to move on one plane. Like, for instance, a hinge joint like that of a door, it only opens so far, right? Just like our elbow only opens so far, unless you can hyperextend your elbow, which I guess some people can. I cannot. And then biaxial means that they're going to be able to move on two planes, and multiaxial means that they're going to be able to move on multiple planes. Okay? And so we could talk about fibrous joints, right? And so fibrous joints are when we have adjacent bones that are directly attached to one another with a fibrous tissue. This gap, it can be big or small. So for instance, sutures are fibrous joints. Remember, this has to do with how are they formed, what is their structure, and not movement. So we could classify these sutures as fibrous joints. But not only are they fibrous, and that's what their structure is, but their function is that they are synarthroses. They're not moving. And then we have syndesmosis joints. Syndesmosis joints are fastened by a band, like those between our ulna and our radius, interosseous membrane, so they can work together as a team. And then gophosis joints we find in our teeth. Okay, and so sutures, again, these are where the sutures of our skull have started to close, right? And so when we're infants or children, we have those fontanelles. Fontanelles are those soft spots. We have them with those interosseous membranes. Remember, this is how we do intermembranous ossification. Is going to occur. Like, here's that ossification center here for the parietal bone, and it's growing towards the frontal bone. They're going to grow towards one another, and we're going to find a suture here. And then as we grow older, we're going to continue to remodel this until that closes all together. We have syndesmosis, and syndesmosis means that they are fastened by a band and they unite parallel bones like those of our radius and our ulna. Also in our leg, we have the tibia and the fibula. So remember, in our forearm, we're able to rotate the radius bone during our forearm movements, right? So we can supinate, palms to the sky, or we can pronate, palms to the planet. Whereas those between our tibia and our fibula, same idea, the same kind of fiber allows for little movement. This is to firmly lock that talus bone between our tibia and our fibula at our ankle joint. Okay? And so these syndesmosis joints, those fibrous joints, they can be narrow, like a ligament, or they can be broad, like that interosseous membrane. And it's fastened by a band to unite these pair of bones. Gomphosis is also a fibrous joint. This talks about fastened with bolts or peg and a socket joint. So like our teeth, right? So we have this bony socket within our maxillary bone. We also have bony sockets within our mandible bone, our lower jaw, and we attach into them with that periodontal ligament, right, that you can see right there. Okay? Scurvy is actually a disease that occurs by lack of nutritional elements, like specifically vitamin C. And when that happens, we tend to see a loss of teeth because it affects this periodontal ligament. Okay. Cartilaginous joints. This is where we can have adjacent bones united together by either hyaline cartilage or fibrocartilage, right? So hyaline cartilage, we're going to see that specifically at that epiphyseal plate of our long bones. We also see it as the ilium, the ischium, and the pubic portions of our hip bone as we go through childhood and adolescence. And then we can see them as a permanent fixture. So our first sternocostal joint, this is where our sternum hits to that first rib. It's costal cartilage. This is a permanent synchondrosis hyaline cartilage. Both of them, temporary and permanent synchondroses, are functionally classified as synarthrosis joints. Our cartilaginous joints for symphysis. Symphysis means growing together, and this would be joined by fibrocartilage. These functionally are classified as amphiarthrosis, meaning a little bit of movement. They can have a narrow gap like that between the pubic symphysis and the manubriosternal joint, and then a wide gap could be intervertebral symphysis. And then we have synovial joints. And synovial joints are going to move the most, right? And so in order to have that increased mobility and to give us that smooth movement, we always have this fluid-filled space. The bones are not directly attached to one another. You can see that they are stopping here. These are long bones attached to one another. It's not always long bones, but you can see this is that synovial membrane, and that synovial membrane is encapsulated in this articular capsule. Okay? We also have these articular cartilages there. The articular capsule is really thin. It's like a Teflon thin layer of hyaline cartilage. Teflon is like that thin stuff that's on nonstick pans. It covers the entire articulating surface of each bone. And that articulating capsule is there to friction. The synovial membrane is going to line the inner surface of our articular capsule, and those cells in there are going to secrete synovial fluid to again give us that fluid-filled space to have increased mobility. We also within our synovial joints can find a bursae and a meniscus. This is a bursa right here. Okay. See it there and there. And then we can have the meniscus. The meniscus is a fibrous tissue. There's different types of synovial joints depending on what type of movement they do. Okay, and so the pivot joint here at our neck, this allows us to pivot our head left, right. Okay. We have hinge joints like those of a hinge in a door, allows us to just move unilaterally or uniaxial. Okay. And then we have our saddle joints. Saddle joints are going to be found between our trapezium and our carpal bone, the trapezium carpal bone, and then the first metacarpal bone. It allows us to move in two planes. Those are biaxial. Okay. We have condyloid joints here between our radius and the carpal bones of the wrist. Also, you can see that movement kind of, you could spin your wrist kind of all the way around. Okay. And then this is a plane joint. The plane joint is found between our tarsal bones. When you take off your shoes and you're barefoot and you sort of step down, you can watch those bones sort of move away from one another to help to distribute the weight evenly. Okay. And then we have our ball and socket joint at the hip. We also have one here at our shoulder. Okay. So just to review some movements really quickly, as you guys know, if you were in class, I would have you stand up and do this. So if you're at home and you'd like to try, just stand up and give it some tries, right? So flexion is where we're bending. Extension is obviously where we're extending, getting longer, elongating those muscles. Okay. We have eversion and inversion. We have abduction and adduction. Abduction is away, adduction is back to the body, circumduction is in a circle, we have rotation. We have supination and pronation. We have inversion and eversion. We have protraction, moving away, and retraction, moving back, like at our mandible. We have elevation, moving closed, and depression, moving open, and then opposition, which is like if you're like your fingers. Okay? These synovial joints, the pivot joint, for instance, is a uniaxial joint, and the hinge is also a uniaxial joint. So these are all moving, right? And they're having some significant movement. So that would be that these are going to be all diarthroses, right? Functionally, we would call these all diarthroses. Okay? We have the condyloid and the saddle, both are biaxial joints, and the plane and the ball and socket are both multiaxial joints. So some specific ones that I want to talk about are in the synovial joints that we have within our vertebral column, like those of the zygapophyseal joint. Okay? This is between the superior and the inferior articular processes, right? So remember, we have our superior articular process on the top, and then our inferior articular processing on the bottom of each one of our vertebrae, and that allows us to have some movement. We have the atlanto-occipital joint. This is between the atlas and then those occipital condyles at the base of the skull, allowing us to nod our head yes. And then the atlantoaxial joint. This is between the atlas and the axis, and this allows us to shake our head no. We have our temporomandibular joint, or TMJ, you probably heard it called. And so this allows us to open and close our mouth. We also can do side to side and protraction and retraction motions of our lower jaw. Okay? And this is accomplished because, sorry, my mouse is doing weird stuff. There we go. You can see here, this is going to be our mandibular fossa. The mandibular fossa, again, is found right at the temporal bone. Okay? And then this is the mandibular condyle, which is on our mandible bone. You can see here that synovial fluid in there that allows for optimal movement. This is the glenohumeral joint. Remember that our humerus fit into the glenoid cavity, which was found on our scapula bone. Okay? And so that's the glenohumeral joint. Okay? This is a ball and socket joint. Here's the ball. This is the socket. Okay? And this actually gives us the largest range of motion of any joint within our body. And it actually gives us an enhanced amount of mobility. But because we have all of this mobility, it reduces stability. Remember, we talked about how the clavicle is the most fractured bone in the body. One of the reasons is that reduced stability here. Arthritis is when we're going to have inflammation of any joint. Itis, that itis suffix, that actually means inflammation of, and the arthro is the joint, inflammation of the joint. This is most common in synovial joints because, again, we're going to have the most movement here. And so if we have the most movement, then we're probably going to have the most amount of inflammation. Okay? And so one of those is called osteoarthritis. And osteoarthritis happens when we have sort of this aging and normal wear and tear of our articular cartilage. Okay? So that articular cartilage right here starts to sort of wear away. We can have gout, and gout results from the deposition of uric acid crystals within any one of our body joints. And then autoimmune disorders. Autoimmune disorders typically were classified as your nervous or your immune system sort of attacked your normal body cells. That's not quite what it means, but it does mean that we have an over response of our immune system, meaning that we're maybe making some antibodies that are not necessary. And so this chart here sort of summarizes our joint classifications to give you an idea. So over here we have our structural classes, okay? And then over here we have the mobility of each one. Okay, so we have our fibrous structural class, and fibrous joints are again united by collagen fibers. That's where fibrous comes from. And there's three different types. We have sutures, syndesmoses, and gomphoses. The suture is in synarthrosis. It is immobile. Syndesmoses are amphiarthrosis, and gomphoses are synarthrosis. But all of them are fibrous joints. Okay? We also have cartilaginous joints. Cartilaginous joints means that we have these bone ends that are united by cartilage. So we have synchondroses. Synchondroses mean that we use hyaline cartilage. Okay? And so those are going to be immobile synarthrosis. And we also have symphysis joints. These are going to be where we unite using fibrocartilage. and those are going to be amphiarthrosis. And then we have synovial joints. The synovial joints means that we're going to have that articular cartilage. We enclose it with a capsule lined with the synovial membrane. There are 6 different types. Plane and hinge are both uniaxial. Pivot and condyloid are both biaxial, and saddle and ball and socket are both multiaxial. And all of them are freely movable. They are all classified as diarthrosis joints. That is everything. If you have any questions, please feel free to reach out to me, and I am happy to help you.